positive cases per 100,000. That's now fallen down to 85.6, which is below the 100 figure. So that's great news as well, which is a fall of 40 cases per 100,000 population. In terms of those wards which are having the highest number of cases are thus. Kings Norton, which has 203. After that, it is Shard End, which has 187. After that, Edgbaston, which has 181. Perry Common, 155. Soho and Jewellery Quarter, 155. Gareth Green, 131. And then Erdington, 127. The real success story is by our NHS colleagues, who are really steaming ahead now with the number of people that have been vaccinated. A third of the UK population have now been vaccinated. That's a real good achievement. So you're looking at about 24 million people have now been vaccinated, and just over 1 million people have been vaccinated with a second dose as well. So the current cohorts of people that are being prioritised are those that are between 65 and 69 and 60 plus, and those that are under 64 but have a health and underlying condition. So we talked about the NHS colleagues, and they have dominated all our love and attention. And recently, the announcement by Boris Johnson and his Chancellor Rishi Sunak just to award a paltry sum of 1% for our nurses and our NHS is absolutely appalling as well. And we are putting plenty of pressure for Boris Johnson to give the minimum which has been recommended, which is about 2.1% by the official pay body as well. So today I have Jared Rapson, who works for the Ward End Fire Service, and the whole purpose was to get an understanding of what the fire station and what the fire service have been doing for the last 12 months as well. So a real warm welcome to you, Jared. Hope you're well. And the purpose of today's show is for you to give us a bit of a background, really, in terms of how last year has been for you and also for your colleagues in the fire service.
Thank you very much for having me on. I really appreciate the opportunity. So if I just start by introducing myself. So my name is Jared. I work at Ward End Fire Station with the West Midlands Fire Service. I've been here for just over 6 years, and hopefully we can just discuss what the fire service has been doing in terms of tackling COVID and maintaining our operational response for operational incidents. And looking forward to it.
Yeah, so do I detect a bit of a Australian accent, is it?
My mum's American, and I've picked up a bit of an accent from her. It's not a
I couldn't quite. You threw me off. I couldn't quite pinpoint you, and I thought there's a bit of a Australian or a New Zealand twang there. But as always, I'm far removed. But I think you'll forgive me, Jared. We've on a Thursday we've been going out on the doorsteps, giving a round of applause to all the frontline key workers, but in most people's minds, if you can forgive me, is we're talking about the NHS colleagues, our doctors, our nurses, people that are working in care homes, and even the police. But you yourselves have been sort of, I don't know, I mean, maybe it's just me, but have been sort of ignored. But we want to sort of try to correct that, really. And so if you can just tell us, how's it been for you in terms of coronavirus and the impact that you had, and how have things changed, and also for your colleagues as well, please.
Yeah, sure. I mean, first off, as you've been doing, like kind of applauding the NHS, huge thanks to them for their valiant efforts, throughout the pandemic and everything, because it's well deserved. Just to talk about quickly what West Midlands Fire Service has been doing since the beginning of the pandemic. Going back to the first lockdown and the peak of that, we were involved with a number of additional activities, really. Was referred to as PMART, which is Pandemic Multi-Agency Response Teams. So we were working with police, with the ambulance service, West Midlands Ambulance Service, with the NHS to deliver essential foods, medicines, things like that to the most vulnerable members of the community. Also delivering personal protective equipment, medical equipment, transporting public health professionals so that they can, do their jobs and help to fight the pandemic. We also volunteered our services to drive ambulances for the West Midlands Ambulance Service.
Wow.
As it turned out, they were quite well staffed and they didn't require our services at the time, but that's something we volunteered for. Um, the PMART was especially to do with kind of body movement as well. So because the NHS and West Midlands Ambulance Service were obviously very, very busy, we assisted with body movement of the deceased to temporary morgues around the West Midlands, which is obviously quite upsetting for people involved.
Absolutely.
So yeah, and then more recently, we've been involved in a partnership with St John's Ambulance, and a number of members of staff within West Midlands Service have volunteered to become vaccinators, so we can help with the rollout of mass vaccination for the public, and hopefully, reducing the spread of COVID-19.
Yeah, no, absolutely. These are sort of the stuff that we want to get out there, because who like to think I've got a finger on the pulse on most things, wasn't aware of the fantastic work. And it's, I would say, logistical supporting role that you were doing in order to support the frontline staff, such as the medical professionals and the police and the ambulance that you already mentioned. Just want to sort of touch on the bit about the PPE. At the height of the pandemic, Jared, we couldn't get PPE for love or for money, and the people were using maybe substandard ones. People were having to reuse the PPE equipment as well. At that time, when you were transporting bodies, when you were giving to the different parts of the NHS, were you sort of really feeling the strain of the limited resources and the fact that the NHS were putting their own staff were putting their own lives at risk in order to deal with COVID patients?
Yeah, certainly. I mean, as you say, it was an increased risk to our staff and to to NHS staff and the ambulance service. However, not being personally involved with those initial activities, I can't speak for the lack of resources. It's my understanding that the West Midlands Ambulance Service and West Midlands Fire Service were sure that we had effective personal protective equipment to allow our staff to be protected. Because of course, while we want to help in any way possible that we can, one of our top priorities is, of course, protecting our workforce so that we can continue to, provide operational availability, so we can respond to fires, to car crashes, to rescues, and that kind of thing, really. So that has been paramount throughout the pandemic, is making sure that we protect ourselves and other members of the public.
I want to touch on more about the body movement. So, I know it's been a year now, but it may be worth just going through the height of COVID, where people were dying almost every minute of the day. People were obviously observing the lockdown. We weren't able to, see our loved ones in hospitals. We weren't able to give the final rites at our funerals as well. It was a real tough time. At the height, how bad was it for you in terms of when you were transporting these bodies, to whether it was to the Nightingale Hospital or whether it was to other mortuaries as well, the temporary ones, the ones that had sort of propped up? What are the sort of recollections that you can think of at that time?
Well, yeah, as you say, I mean, it was a very upsetting time, isn't it? And due to the nature of our work, mercilessly, we don't come across, fatalities very often due to our prevention work and our protection work. However, we do have systems in place to deal with, it's what we call diffusing sessions, and counselling is offered for things like that. So if people, are affected by what they've seen, what they've activities they've had to carry out, then there is support services available for staff to talk about, really. to avoid any issues and troubles in the future, really. Yeah.
One of the things that I've certainly felt is that now I'm looking forward to the ease of the lockdown on the 12th of April, where I can maybe meet a few family friends for a cup of tea, go outside, have a picnic in the park. And I've really missed that. And, I know you've all been sort of tested regularly as well, but, you're at least seeing some of your colleagues, and the camaraderie within the West Midlands Fire Service must have been an important part in helping you to cope with some of the stories and with some of the stuff that you had seen at that time.
Yeah, absolutely. I mean, I consider, ourselves quite fortunate that we have been able to carry on working, because we are emergency service. Lots of family and friends have been furloughed and everything. Of course, there's been implications with mental health issues and things like that. So as you say, the camaraderie amongst the fire service and with the other emergency services as well, the police and ambulance, that has been very supportive. Absolutely, yeah.
Thank you. Just a couple of questions that are coming through. First of all, Walaikum Salam by Majid. How are you? You okay? Hope everyone is well. Just a question really by Mr. Javed, who's saying, since COVID-19 and lockdown, has there been an increase in fire call-out since more people are working from home? Or did you see a reduction because everyone was in lockdown in the number of call-outs for example, fires at home?
Yeah, that's a good question. Apologies, I don't have to hand statistics and reports and everything. In my personal experience in this area of West Midlands, we saw a reduction in road traffic collisions as there was less people on the roads and everything, and I believe a slight increase in kind of fires within the home. And everything as well. But again, apologies, I don't have statistics.
No,
Perhaps
no,
something
that's
I can
fine. It's
provide
just someone. No, no,
let
that's
you
fine. That's fine.
know.
And I would imagine last year, one thing that I noticed was people were under the first lockdown. They used that as an opportunity to do a bit of gardening, to do a bit of sort of housework. And at that time, people were sort of, doing a lot of barbecues, a lot of garden fires, clean up their gardens. They had almost like, too much time on their hands. But did you see, just anecdotally, a lot more sort of call outs for garden fires, bonfires, for barbecues that may have sort of, the male sort of trying to be a sort of a chef at home in the barbecue in the garden?
Yeah, absolutely. Again, as you say, it's anecdotal for our station, as I don't have the statistics. But there was certainly an increase in garden fires. As you say, people took it as an opportunity to for home renovation, garden renovation, that kind of thing, which is understandable. I mean, it's worth just kind of reminding people that there are kind of the recycling centres in Birmingham are open. I think some require time slots and things like that, but they are open. So our advice would be to take waste and everything like that to the recycling centres as opposed to burning them. Really, the issue with them as well, of course, if they're not properly controlled. So if there's not some kind of extinguishing media like a garden hose, or if it's too close to flammable materials like a garden fence or a tree, then of course it's very easy to spread, and it's obviously no one's intention for a garden fire to get out of control, but we do see it more often than we like. So that would be our advice. If you can take it to a recycling centre, then that would be preferable to burning waste in the garden.
No, no, most definitely. And, last year I was doing my own house up at Jared, and I had quite a lot of bushes and stuff. So I decided to sort of give it a bit of a light. And within a short space of time, it was getting a bit uncontrolled. But luckily, I just put it out and I just hired a skip. And I thought, I don't want to take a risk of getting it uncontrolled. I mean, it cost me a bit of money, but it was a safe thing to do.
Yeah. The thing with garden fires is, in Birmingham, people are fine to burn garden waste. The issue is if it becomes a nuisance to neighbours as well, then it becomes an environmental issue. So quite often we're called because, we're called from a neighbour when smoke from a garden fire is kind of coming onto their property. So that's why we'd have to turn out to it. And then, of course, as well, if it spreads and becomes out of control. So yeah, so that would be the advice.
Yeah, and I suppose that sort of translates itself now because we're almost into spring now, and in the next few months as well, people will again get a bit of green fingers and will start sort of pondering into their garden and thinking what they can sort of get rid of. And again, it's the same thing. So maybe learn some of the lessons, and also what Jared is saying. Please be careful about what you can and can't burn. And try to maybe go and use the local recycling centres, which are open, I think, on still a pre-booked system. So once you booked it, you know there's not going to be a long queue to dispose of your waste as well. The other thing I want to sort of touch on now, if I can, is we mentioned the last time we actually met was not too far from here, either yourself or your colleagues here, where people are unfortunately speeding maybe at the height of lockdown, and now there's less traffic on the road, and some people are using that as an opportunity to maybe put their foot down. And unfortunately, because of the speed that they're traveling in, we've certainly seen a certain increase in the number of serious RTAs, albeit with less traffic, simply because of the speed that they were in. And what's your message to those people that maybe think that it's okay to speed when there's less traffic, certainly during the initial 2 lockdowns?
Yeah, of course. No, that's a really good point. Yeah, so obviously, just because the roads are clear doesn't give anybody the right to break, the rules of the road and everything. And also, it's worth considering as well that the roads aren't completely empty. That there's still pedestrians. That there are still other road users. And also, we've been praising the work of the NHS and emergency services and stuff like that. And if people consider if they are involved in a road traffic collision, then they're putting ambulance service and NHS staff at risk, because now they're having to go into hospital and increase their workload, taking time away from from people with COVID, that kind of thing. So just consider the wider implications of actions, really.
That's a great point, Jared. It's something that it hasn't occurred to me, and I want to sort of echo that. So please, for those of you that are listening, thinking that it's okay to put the speed down, just try to save 1 or 2 minutes on your journey. That's all it is, just 1 or 2 minutes. That's all you tend to save by breaking the law. You're putting your own lives at risk, your passengers, and the wider community as well. And all you are doing is, if anything does happen, you are already adding more burden onto the already overburdened NHS as well. So please think carefully before you do it. The other thing I was going to ask was, Jared, about, during COVID, obviously we have to maintain social distancing and only go where it is deemed essential. So you normally, I know you're very good at, giving safety advice to businesses and to residents about their fire and their safety risk. How have you managed that during COVID? Has that come to a halt, or have you still tried to navigate that, but in a safe being?
Yeah, no, yeah, thank you for bringing that up. As people may be aware, we carry what we call safe and well visits, where, so before COVID, we would come into people's homes, conduct an assessment, talk through fire safety and just home safety advice, and then we'd fit smoke alarms. That service has been continuing all the way through the pandemic. The differences are, though, that according to certain criteria, there's a bit of a list that we go through now, and most of our safe and well visits are carried out remotely via telephone. So we can gather information on fire risk. We can give fire safety information, home safety information via the phone. Then if people meet certain risk factors, certain criteria, such as living on their own, evidence of previous fires, smoking, mobility issues, those kind of things, then we can carry out a face-to-face visit. Of course, as I mentioned earlier, we need to look after our own safety as well. So there's an increased personal protective equipment level, and also we make sure that we ask questions such as, if anyone in the household has tested positive for COVID-19, if they've been told to isolate, or also if they're in the more vulnerable category and having to shield themselves or someone in the house. If all the criteria is met, though, then we can carry out a face-to-face visit with that increased level of personal protective equipment. We can still fit smoke alarms in people's homes to make sure that they're safe in the event of a fire, and just give them that extra time to withdraw from the property if in the event of a fire, basically.
Yeah, thank you for Jared. I hope that answers your question, because one of the listeners is saying, does the fire service still provide smoke alarms free for residential home. And Jared has answered your question, so I hope that's okay. Someone else has sort of said, what is your response time in terms of call out time and reaching the areas of the incident? So what, because I know, even though there's normally a lot of traffic sometimes at peak time, but some of your response times are really awesome. You're there in quite a short space of time. So, if you can just maybe give us an average sort of response time.
Yeah, sure. Sorry, I've just going back to the previous question just for a second, if I may. Is that all right? I've
Yeah,
just
yeah, yeah,
I thought
absolutely.
am I okay? Am I okay to just give our contact number to
Of
your
course you are.
listeners? Yeah. Okay. Excellent. So, if anyone wants to write this down, the contact number to have a safe and well visit, carried out is 0800
Yeah.
5525. Okay, so if you phone that number, that goes through to our contact center. They'll ask you the screening questions in terms of COVID and risk factors, and then that'll be put through to your local, your nearest fire station, and then the crews will be in touch to carry out the visit.
No, that's
Yeah,
great,
thank you.
really. No, no,
So
anything
yeah,
for free, anything. Yeah, that's right. We'll lap it up. So I hope you got that, Javed. The number once again is 0800 389 5525. And we'll give it again once more right at the end as well. So thank you for that, Jared. So just a question about
that's
the
great.
response and the call out times. How has that fared during lockdown? And maybe now that we're sort of, with the kids going back as well, what's the response time for yourselves?
Yeah, sure. That's a good question. So in the West Midlands Fire Service, we have a 5-minute response time to what we refer to as Category 1 incidents. So that's house fires, persons trapped in a road traffic collision, those kind of things. And the 5-minute attendance is it's one of the best in the entire country, basically. We've got 38 stations located throughout the West Midlands, so that we're able to provide a response for that 5-minute attendance time. Um, and we've been able to maintain that, throughout the pandemic. As I've mentioned, a priority has been kind of keeping our staff, healthy and available to respond to emergencies. We have had some issues in the fire service with people contracting COVID. I myself, contracted COVID, and a number of my colleagues. However, there's systems in place to make sure that our staffing is at an optimum level, so we can still respond to emergencies.
No, that's great. That is. Just going to move things along now. We've got about 10 minutes left now, Jared. So, a couple
Yeah,
of
no
things
problem.
really. The two things that, when I think about the fire service that come to my mind are the Grenfell disaster that took place a fair few years ago, where, because of the cladding, the fire just really engulfed the whole building as well. And also in terms of austerity as well, you mentioned some of your colleagues as well. So before we go into austerity, but just Grenfell, have you been doing some site visits to those big, tower blocks, and have you sort of seen some cladding that shouldn't be there, and what are your thoughts about the speed at which these cladding have been replaced or are being replaced?
Yeah, sure. No, it's a fair comment, because I can imagine, that there's lots of tower blocks within West Midlands, and I can imagine people that live within them are very concerned after seeing the events of Grenfell. There was a very large inquiry after Grenfell, obviously, and the impact of it has gone through to the rest of the fire services within the country as well. So since then, we've been constantly carrying out visits to high-rise tower blocks. We have a special department, a fire safety department, that's been kind of spearheading those visits, but operational staff as well have been visiting them as well. Um, to my knowledge, a small number of residential high-rise buildings have had some slightly more flammable cladding, which has been replaced, in line with the inquiry and everything. Another thing with the Grenfell that we're finding is just kind of restoring that confidence in the fire service, and in terms of what people are kind of asked to do. So we've had quite a big change in our procedures since Grenfell, to make sure that information that's given from people calling 999 is given to the operational crews on the instant ground. So we refer to it as fire survival guidance. So there's now quite robust systems in place. So when people phone 999, the information on where they are and everything, it goes straight through the instant commander, and it can be acted upon immediately. Also, it's worth mentioning that a number of tower blocks, they have what's called a stay put policy. So again, just to reassure people, the construction of tower blocks, residential tower blocks, allows for the compartmentation of each individual flat to be protected, basically. So if there's a fire in one flat, people, can be safe in another flat because of the compartmentation there. So if the building's policy is stay put, then it's safer for occupants to be doing that as opposed to leaving their flats and potentially going into a stairwell that could be heavily smoke clogged, or a lobby area, that kind of thing. So I completely understand people's concern, though. We've certainly experienced when we've gone to fires in high-rise tower blocks, people are exiting the building as fast as possible because of what they saw on the TV with Grenfell. So just to kind of reassure people that a lot of work has been done after the inquiry of Grenfell, and that as responders, we do everything possible to keep people safe in those kind of incidents.
Cheers, Jared. I remember London's Burning. I don't know if you remember the program, 80s or 90s. There used to be a program around the fantastic fire people. I don't know whether you're probably too young for that, but the question has come through that what are you doing in the fire stations when you're not out on an emergency call? And I suppose before austerity, as one of the comments says, we're probably having cups of teas, coffees, biscuits, and playing cards. But I think since austerity, I don't think you've got any time spare, really, do you?
No, those days are long gone. Certainly before I joined the fire service, and that's not the reality, I'm afraid. Pre-COVID, then we would basically half of our time, more so, is spent doing prevention and protection activities. So physically going around to people's homes, carrying out these safe and well visits that I mentioned, fitting smoke alarms, visiting businesses, making sure that everything, all the safety things are in place. Since COVID, these things are still taking place. However, they're just being done remotely. So, like I mentioned, the remote safe and wells by the telephone. So we're still doing lots of these things as well. Because we've had more time on station, we've been using this as an opportunity to increase the amount of training that we've been doing as a station, so that we're even more prepared for operational incidents that we're turned out to, basically.
No, thank you. I hope that clarifies your cheeky comments, Pops and Jav. On to the last point, really, Jared. I know I've been involved with yourselves when you have open days, when you have outreach events. You're trying to let the wider community come in and have a look at what's behind those red shutters. And you've had sort of various sort of community engagement events, and we've had a quite closer look in terms of how you break open a car with your sort of those sort of metal can opener, shall I say, and get the residents out, and also climb the tower, burning tower, and rescue residents as well. And it's been amazing in terms of how skilled and how quickly you work under those circumstances. But still, the people from a BAME community, the Black Asian minority ethnic, are of a low percentage in terms of overall. So what more can we be done, Jared, in terms of trying to attract more Black, more African, more people from the LGBT community, more women as well to come and join what you would, I'm sure, say that this is the best career, it's a fantastic profession for you to come and join and have a leader, fruitful life. What would you say?
Yeah, absolutely. As you say, it's an amazing job. I'd recommend it to everybody. So, there's a lot of people that may not have considered a career in the fire service for whatever reason, but as I say, I'd certainly recommend it. We are absolutely encouraging applications from female candidates and members of BAME communities, as they are underrepresented in the fire service. That is a focus in our recruitment. With recruitment, we currently have an ongoing recruitment drive. So applications are open at the moment. If people are interested in this, then they can go onto the West Midlands Fire Service website, which is just wmfs.net, and on that page is the careers page. So there's information there just explaining what the role of the firefighter is. Kind of, is it for me? What we do on a day-to-day basis, benefits, all that kind of things, frequently asked questions. So that would be my advice is to, consider it if you haven't before, and visit the website for much more information on what the job entails and how to go about the recruitment process, basically.
Yeah, so I remember when we came about 2 years ago, I think it was, and I brought my daughter who was about 7 at that time, and she was really inspired, and she goes, I want to be a firewoman. And then after about 2 or 3 months, she goes, I'm not sure because I'm scared of blood. But otherwise, she was really inspired by yourselves and your colleagues about, how wonderful you were and how welcomed you made her feel. So someone asking, are there any vacancies? Jared said that there are continual vacancies that are being advertised. So go on to www.wmfs.net and go into the careers, and they are looking for people from a underrepresented cohort, which is the BAME community, people from the female gender, people from the LGBT as well. This is a fantastic career. I've known the Ward End Fire Service colleagues for a number of years now, and I've seen a couple of Asian people in there, a couple of sort of black fire service as well. So, I think those sort of days where in the 80s we were a bit, afraid of joining the police force and the fire service because, we may be sort of, there may be racist abuse. I think that's long gone as well. And so please, I want to use my own platform to encourage everyone to go and use the website to learn a bit more. And if that's of interest to you, I certainly do apply. And just want to give you a question, and please, if you don't want to answer because it may be a bit political, please, just ask me to move on. But about positive discrimination, I know there's this argument that there should be maybe even a lowering of standard for people of a BAME background for them to be accepted into the police force, into jobs where we are underrepresented. Just to put it on record, I don't believe in that. I believe the benchmark is what it is, and it's up to everyone to reach that. But I don't know, what's your thoughts about positive discrimination without getting a bit too political, Jared?
Yeah, well, as you say, I mean, as you've already stated, the standard is the standard, and our kind of tagline is fire doesn't discriminate, and neither do we, basically, So in terms of encouraging more people from a BAME background and female candidates, it's more in terms of targeting those people to consider application as opposed to lowering standard, which definitely isn't the case, I think it's worth mentioning as well, considering kind of what people might think in their heads as barriers to joining the fire service, which that we can dispel. So there's no age restrictions or height restrictions or anything like that with joining the fire service. If people are concerned about kind of religious, implications and things like that, I mean, I can tell you that we've got a number of firefighters on our station who are, who are Muslim and make the job work for them. Of course, there's some considerations like working during Ramadan and everything. But as I say, these firefighters, do it and they adjust, how they work to fit their religious needs and vice versa and everything. So, just want to, encourage people.
Absolutely. I can't remember your colleague's name now, and I met him. He came down to our football academy again a couple of years ago, and he was saying that whenever he's not on an emergency call, if he wishes to go and pray Then the fire service and his boss is understanding, and obviously they made sort of allowances during the month of Ramadan as well. And he's saying, look, as a Muslim, I can't expect any more from the fire service, and hence why I'm here, and I'm advocating and telling your children to do the same. Coming to the fire services, this is what you want to do, because they made me feel welcome, and I want to pass that experience on to other people. So last question before I ask you to just summarize, if I can, Jared, is if a road is blocked with parked cars, does the fire service have a right to drive through in an emergency? So like you got a narrow gap, I think, and are you able to sort of force your way through? I think that's what they're sort of saying.
Okay, so we're, one of the legislations that we're governed by, it's called the Fire and Rescue Services Act 2004, and within that we've got certain powers on the road. So obviously we're responsible for firefighting and rescue operations on a road. We can close a road, we can redirect traffic, and we can also break into someone's car without their consent. We're not permitted to bump cars out of the way with the fire engine or anything like that, or like damage cars. But it's much more likely that we would find an alternative route to an RTC. However, with saying that, it definitely is something that we face on a day-to-day basis. Is responding to an incident and being faced with cars that are double parked, and limiting access to incidents. So just for your listeners to consider considerate parking, and just think about emergency vehicles responding to emergencies, basically.
Yeah, because I know you can imagine an area like Column Rock, Ward End, where the roads are quite narrow, and you probably experienced it overnight. People will, you've got the two sides. People will also, park their car on one other side of the roads, allowing just enough of a room for a car to go through. But for a fire engine or maybe a van, it's very difficult as well. So, what's your message to those people that just park their car overnight, onto the road?
Yeah, well, like you say, just consider that there will be larger road users, going through those spaces, like not just fire trucks but ambulances as well. So and just consider what they're going to. That they're going to emergency incidents to help people. It could be members of their family. It could be themselves. So we need to kind of follow these rules for the sake of everyone, really.
Yeah, thank you, Jared. We are now towards the end of the show. It's been a really fantastic insight into what the West Midlands Fire Service and yourselves have been doing over the last 12 months as well. You certainly opened my eyes that you haven't just been, should we say, passengers in this. You have played an active part in making sure that we saved lives and livelihoods. I'm going to allow you to just, have a final thought, a concluding remarks to our listeners and our viewers, Jared.
Yeah, well, just thank you for having us on the show, and as I say, being able to let people know about what we're doing, and make people aware that we're still carrying out the same services that we were before the pandemic, and that they're available still. Yeah, and just in terms of what we do throughout the pandemic, these are additional activities, but at the end of the day, as an emergency service, our main goal is just to help people however we can. So we're happy to provide any kind of assistance during this pandemic, and but as I say, our main priority is to ensure that we can respond to emergency incidents, which we've also done, as well as these additional activities. So, but
thank you, Jared.
Yeah.
I'm going to read out one comment by our listeners. I think it just sums up everything that we're all feeling at the moment. We are so proud of our fire service. We salute you and your colleagues for putting your lives at risk to save us and look after the community. And that's, echoed from all of us at ZMC Network and the wider community as well. So thank you for your time today, Jared. Really appreciate that, and give my regards to everyone. And so that was Jared Rapson, who is a member of the Ward End Fire Service. And he was here talking about the role that they have played, maybe not more visible compared to our NHS heroes, but nonetheless they have been pivotal in terms of supporting and making all the logistical possible for the NHS and the police and the A&E service to do their jobs as well. So I think the number is 0800 389 5525 if you wish to book yourself a safe and risk assessment, which at the end they will also provide you with a smoke alarm. Alternatively, if you are looking or interested in pursuing a career within the West Midlands Fire Service, then please do log on to their website, which is www.wmfs.net, please, and click on careers. I hope you found it useful. Thank you as always for your timely support. Please, I will use this platform to encourage all of you to complete your census that should be receiving through your door and your letterbox anytime now if it already isn't. And please remember to capture your ethnicity and your nationality as well. Until next week, please look after yourselves and each other. God bless.